All right, so now what to expect after surgery in the hospital. The day you have surgery, you will be NPO, nothing by mouth, as mentioned earlier. You will have IV fluids running, so you won't be dehydrated. The next day, post-op day 1, the dietitian will come to see you and review all the main points discussed in this presentation. You will be given a no sugar added clear liquid meal tray with juice, high protein broth, jello, water, and ice chips, all things that you can see through. No caffeine, no carbonated beverages, and no straws. The caffeine dehydrates you faster. The carbonation in straws bring in more air into your body, which we want you to expel after surgery. There are also sugar-free popsicles on the unit available by request. And here are some examples of the clear liquids you will receive on your trays while in the hospital. As mentioned earlier, you will be using a 1-ounce medicine cup for the first day after surgery. This is used to measure how much you are able to drink prior to discharge. It is not a shot glass. You are to sip from the medicine cup over the course of 10 to 15 minutes. Put it off to the side, wait about 10 to 15 minutes more, and then get a new cup of liquid. As soon as you are discharged home, your diet is advanced to stage 2 full liquids, and you can begin your vitamin and mineral supplementation. This means that you can have all of the clear beverages you had in the hospital, and you can add skim low-fat milk, soy, rice, and almond milk are all fine, and you can start your protein shakes. You can buy the pre-made drinks or the powder. Just make sure the nutrition facts label reads less than 5 grams of sugar per serving. Brands that patients have had the most success with are the Atkins brand shakes, Pure Protein, Premier Protein, Muscle Milk, and Isopure. For the first couple months post-op, avoid using a blender and adding fruit to make shakes. Using the blender incorporates more air into the shake, which will fill you up faster before you get in all of your protein, and adding fruit too soon will cause excess gas and bloating because of the fiber. So your first week after surgery will be all liquids. At your post-op visit with the surgeon, your diet will be advanced to stage 3 or soft foods. Here are some important diet changes or things to avoid after surgery. Sugary or sweet foods, which can lead to dumping syndrome and overall excess calories. Caffeine, which can worsen dehydration and lead to stomach ulcers. Carbonated beverages and straws, which bring more air into your body and lead to stomach or pouch stretching. Lastly, alcohol, which can lead to dehydration, excess calories, and dumping syndrome. Now I want to talk a little bit about label reading. It is important that you start reading all nutrition facts labels and looking at the ingredients in foods. Anything ending in OSC is a type of sugar. Examples are glucose, sucrose, lactose, fructose, maltose, and dextrose. Those are all names for sugar. Other forms of sugar are corn syrup, high fructose corn syrup, molasses, agave, and honey. Sugar substitutes like Splenda, Equal, Sweet and Low, Stevia, and Truvia are perfectly fine to consume after surgery if you like them. If you don't like sugar substitutes, then you don't have to start having them. They are just another option. Now 100% fruit juices are okay after surgery. Make sure on the label they say 100% fruit juice or no sugar added. These are okay because the natural sugar found in fruit and fruit juice, fructose, does not have the same effect on your body's insulin production that sucrose or table sugar has. However, fruit juice does still have calories, so make sure you practice portion control. Don't have a giant big gulp-sized glass of orange juice every day, but if you want that 4-ounce cup of apple juice in the morning, that is a viable option. Again, table sugar and high fructose corn syrup are not okay after surgery and will not be well tolerated. The sugar found in milk, lactose, is sometimes not tolerated after surgery. If that is the case, lactate, soy, rice, and almond milks are all perfectly acceptable replacements. Here are 2 examples of nutrition facts label. The ingredients printed on these labels are listed in order of density. So the first 5 ingredients are going to be the most prevalent in that food item. If those 5 ingredients are all a form of sugar, that will not be a good choice for you to have if you are going to be successful after surgery. So here are some behaviors to be aware of that may arise over time and lead to weight regain. Binge eating and grazing throughout the day can lead to excess calorie intake. Recognize when you are hungry because you are stressed or sad versus actual stomach hunger. Slow down when you eat. Take small bites, chew food thoroughly, put your fork down between meals. Fun fact, it takes your brain 20 minutes to realize your stomach is full. So by eating slowly, you give your brain time to say, okay, I'm full now. I can save the rest of this meal for later. Here is a picture of 2 plates. I want you to think about which plate has more food. Neither. They have the same amount of food. This visual shows you that plate size does matter. The plate on the right looks emptier and can cause you to want to fill it up with more food. By using smaller salad plates and bowls and even smaller utensils, you are able to practice portion control while still feeling satisfied. This is another visual to illustrate that plate size does make a difference in your success after surgery. While I have this picture up, let me give you my last fun fact. When you do sit down to eat, make sure to eat your protein first, which will fill you up faster. Then move around and eat your fruits and vegetables to get all those nutrients. And save your starch for last, if it is even on the plate. That way, by the time you get that far in the meal, you will already be full. Alright, so some tips for long-term success after surgery. Protocol, protocol, protocol. Make sure you follow the surgeon's post-op diet instructions and diet steps to ensure success. You will be advancing to 5 to 6 small meals per day. Make sure you get in your 64 ounces of fluid every day, in addition to your protein and vitamins. Make smart food choices, like what order you eat your food as described previously. And lastly, make sure to take care of yourself and take responsibility of your new lifestyle. Best wishes for a healthy future.